My name is Thomas Brennan. I'm a reflexologist. I work in private practice in Sedona, Arizona. I also train reflexologists. What we're doing here is a video on the skill of foot palpation. Palpation is location by touch, so we're locating by touch the features of the foot. So those will be the bones of the foot and some of the soft tissues of the foot. We're going to start with palpating the bones on the medial aspect of the foot. A little bit about why have palpation skills. For reflexologists and for other professionals, we want to find the exact features of the foot. So when our work is approximate, we are going to get so-so results. When our work is exact, we can get great results, and that's the difference. From one person to the next, the various features, the shapes of the bones, the locations of the bones, size of the bones, can vary greatly, can be huge differences. Every variety that you can think of pretty much exists, and if you work as a reflexologist or work on the feet a lot, you're going to find huge variations. So for that reason, it's important to have the skills to be able to locate the features consistently over a wide variety of feet, shapes. This is the plastic model. These are the bones of the calf and the bones of the foot. This is the tibia, which is the large bone in the calf, which is on the medial aspect of the calf. This is the distal or inferior extreme of the tibia, which we call the ankle. And so in vernacular, that's what we're going to be calling the ankle. And in anatomical terms, we'll call that the medial malleolus. So the medial malleolus here is at the inferior extreme of the tibia, and it's medial. It's on the inside of the leg, or the aspect that's between the calves. How we're going to palpate that is this. I'm going to put my hand around the calf like this, and I'm going to put my thumb, the pad of my thumb, right where I think that malleolus will be. Now again, in some people, it's just going to stand right out there and you'll be able to see it. But there are people in whom it's simply not visually apparent. And nothing wrong with that, or good or better about one way or another. It's just that as professionals, we need to have the skill to find the features. So if I put my thumb where I think the malleolus is and start to move the foot, flex or extend and flex the foot like this at that ankle joint, what's going to happen, and it doesn't even have to be that extreme, is I will feel that this malleolus is not moving. If I'm doing this and what's under my thumb is moving, then I know for sure that I'm not on the malleolus. So, for instance, if for some reason it was difficult to discern where the malleolus was, and I put my thumb on the talus, this bone here, and I start to move the foot around, guess what? I'll feel that talus move under my thumb, and I'll know that I'm not on the malleolus. So I move a little bit superior, like this, and there I am on that malleolus, like this. And that's our basic skill. So the next thing, we're just going to go in sequence here. The next feature is that immediately inferior to the malleolus, so inferior, in the inferior direction, is going to be this bone, which is the talus bone. The tibia and the fibula, see, turn it over here. There's the fibula, which is the smaller bone on the lateral aspect of the calf. The fibula and the tibia both together rest on the talus bone. So we're working on the medial aspect here. If I move immediately inferior to that malleolus, I'll find a flat spot. And when I find that flat, that's going to be the talus. How I can check in this way by extending and flexing the foot like this at the ankle joint, and I'll feel that talus. See how the talus is moving? I'll feel that talus move under my thumb. This is the distal extreme of the tibia on the medial aspect of the leg. There's our medial malleolus. I'll put my thumb here and then move inferior to that, and I'm going to find this flat spot, which is the talus bone. To be sure about that, if I move the foot, if I extend and flex the foot at the ankle joint, I'm going to feel that talus move under my thumb like this. If I press firmly on the talus like this, while doing that, I'm going to stabilize it and it won't move so much. But I can vary my pressure and feel it move, and then I'm going to know that that's where the talus is. After I've located the talus bone in this way, I can move my thumb back and forth, malleolus, talus, feel it move. That becomes clearer. If I place my thumb firmly on the talus bone and my fingers across the top, these bones here, those bones there, are the metatarsals. So if I place my fingers firm across the top of the metatarsals and my thumb, so you're going to see my thumb here, is on the plantar aspect of the metatarsals, like that. So I'm gripping the metatarsals like this, putting my thumb firmly on that medial aspect of the talus bone, and if I rotate the metatarsals slightly like this, you can see these other bones here, these other bones are all moving. And you can see as I grip the talus bone, it's not moving. So that's our methodology for locating the other bones. This bone here is the navicular. The prominence here is the tuberosity of the navicular. The tuberosity from one person to another, the tuberosity of the navicular can in some cases be very prominent, and other cases is simply not going to see it. So for that reason, we want the skill to locate it. So I'm pressing my thumb firmly on that talus bone like this. I'm rotating the metatarsals. Doesn't have to be a lot of movement. You can see even with a relatively small movement, the other bones move. As I creep my thumb out from here in this direction like that, and eventually I will get to a place where I can feel the talus bone is not moving, and I can feel the navicular moving. All right, that's revealing to me by palpation, because I can actually feel it under my thumb, this joint, which is that talonavicular joint. So as I do that, I can continue to move my thumb a little bit more. Meanwhile, I'm applying pressure to the talus so it doesn't move, and I can locate that navicular bone. Now, this is the medial aspect of the navicular, which is what I want. And so I can feel it move. I can feel that prominence, which may be slight, but if I'm moving it like this, eventually I'll be able to feel that prominence, which is the tuberosity of the navicular, and I can feel it there. Now, the next bone here, medial or first cuneiform here, is we're going to want to be able to locate that again, locate it by palpation or by touch. Same methodology. Here I stabilize the talus with my thumb. I'm going to do the same thing with the navicular. I'm pressing on it with my thumb like this. Now I have my hand fully around the ankle joint and the heel here like this. Some people's feet will be too large for that, and we'll find another way of doing it. All right, now if I'm moving this, I can feel that navicular. See, I'm going to reposition my hand here. I can feel that navicular moving. I'm going to apply pressure. It's going to stop moving, and here's the cuneiform moving. So the same thing, kind of a gentle movement of twisting or rotating those metatarsals like this, and I'm stabilizing that navicular. If I creep my thumb out in this direction here like this, eventually I'll be able to feel that that navicular, which I've already located by touch, is not moving or is moving very slightly, and that medial cuneiform here is moving more as I twist or rotate those metatarsals slightly like this. And I'll be able to feel this joint acting, the movement of it. And that's how I know where it is. Alrighty, then I'm going to continue to do that and move this. I can keep part of my thumb on that navicular as I'm moving across that cuneiform. Can feel it move. Alrighty, so then I know where it is. Here we go again, same thing. Now, I'm kind of moving these metatarsals slightly and stabilizing that cuneiform with my thumb. Now, on a larger person, I might need to move and grip across the front like this. Still, I don't have to completely stop this from moving. Just if I put some pressure on it from the medial aspect like this, support it, and rotate these like this. It doesn't even have to be that much. Eventually, I'll feel the difference. One is moving more than the other, like that. And I'll feel this joint act. Now this joint here, this bone is the first metatarsal. This is that medial cuneiform. This joint and the base, this is the base of the first metatarsal. This joint and the base of the first metatarsal, one of the more difficult features to palpate on the foot. In many cases, it's really just about completely undiscernible. Now here we show a little bit of bell shape on this, on the base of this first metatarsal. In many cases, you're going to be palpating that, trying to palpate it, and there will be no discernible difference along the shaft of it right onto the cuneiform. You'll be there's very little change there, so you would be basically struggling to palpate that feature. So how we do that, again, is we're going to grip the foot, put some pressure on that cuneiform, which now we've gradually located the bones going out like this, put some pressure on there, continue to move the metatarsals like this, and we'll feel that joint move. Once we've felt the joint move, so we feel the joint move because we prevent the cuneiform from moving by a little bit of pressure on it, like this with the thumb, move that first metatarsal by moving all of the metatarsals, and one is moving more than the other. We can feel that joint. Once we've felt that, in many cases, we can actually then discern this joint here, which will feel very, very much like a kind of slight dent there in the foot, on a living foot. Almost no feature to it in many cases. Alrighty, so from there, first metatarsal. So here we did this. Malleolus, talus, navicular, medial cuneiform, first metatarsal, the base of the first metatarsal. Here we have the head of the first metatarsal and the phalanges of the great toe. So, the phalanges of the great toe, the proximal phalanx and the distal phalanx. Now, in most cases, more often than not, these two bones, the two phalanges of the great toe and the joints, the joint between the head of the first metatarsal and the base of the first proximal phalanx will be easily discernible. In some cases, though, you're going to want skill to find them because they're just simply not going to be so apparent. So that's rarer than these other features. More frequently will be difficult to discern, some of them. But these are pretty commonly discernible. But some cases, you're going to want this skill. So how we do that is this. Now I've changed hands. I'm gripping across the metatarsals like this and grasping that great toe like this or like this, and I'm going to dorsiflex and plantar flex that toe like this. And I'm putting my finger here, and I'm going to creep my finger into location so I can feel that joint open and close. Now it's easiest to discern on the dorsal surface of the foot. So that's where I'm going to start, like that. Afterward, I can still stabilize this first metatarsal, and then I can feel it open and close on the medial aspect here as well. More difficult to feel it open and close on the plantar aspect simply because there's more tissue in the way there. Alrighty, now here's going to be that first interphalangeal joint here, which is the joint between the proximal phalanx and the distal phalanx of the great toe. How I'm going to discern that? Same basic technique. I'm going to stabilize that proximal phalanx and move the distal phalanx. I'm doing like this, and I can put my finger in position over where I think that joint will be, and I can feel it open and close like this. Now, obviously enough, in many cases this will be easily discernible, visually discernible, but in other cases, no. We're going to need our palpation skills. So we do it like this. All right, now one other thing, which will be not so easily discerned here in this demonstration. This joint here, now this bone here, which is, normally we would call this the heel bone. This bone is the calcaneus, and this feature of the calcaneus here is the tuberosity of the calcaneus. So it's the tuberosity of the calcaneus, which is what we call our heel bone. The calcaneus is a large bone, and it extends underneath the malleolus like this. The talus, which we looked at before, rests on the calcaneus. It's right here. It's a saddle joint right there. All right, now sometimes we're going to want to be able to palpate this joint here, which is that subtalar joint. The place where the talus bone rests on the calcaneus, that's the subtalar joint. Sometimes we're going to want to be able to palpate that. How we do that is pretty much the same as our skill for palpating the other joints. Now, this is a little bit inaccurate. The model is a little inaccurate in the sense that in many cases, this talus bone will be a little more prominent, a little closer to this surface, but close enough. How we're going to palpate that, it's pretty simple really, is that we can stabilize the talus bone. Now this is all screwed together because it's a plastic model, but the skill is basically the same. Going to stabilize the talus bone, and then in most cases, this joint will move. So we're going to just, if we grip the heel like this and press on that talus like this, we'll be able to feel that joint move. It's not a joint that moves a lot, but it does have some movement to it, and we will be able to find that. And we do want to find, as reflexologists for sure, we want to be able to find the subtalar joint. So there you go. That's our demonstration on the plastic model of our skills for palpating the bones of the foot.